Yes. Yes, good evening, Meera Manoj. Good evening, best shows. So, we are going to have a different setting today. Yes. Today we are going to have some discussion regarding various things. Yes, good evening, Nathan Navin. Right. So what are the things that we have to notice today? So we are going to focus on some things which are very, very important. We have changed our strategy because so far we were in the defense mode. Now we are in the offense mode. We are not going to do any defending now. We are attacking mode. Yes. So Google official OET. So okay, take your notes and keep it handy. A lot of activities we are going to do now. Actually, I was thinking of starting live official sessions like this from this month itself, but because of some unforeseen situations, we are just postponing a little bit. So I had to start now itself. This is assessment criteria for OET writing PDF. Writing assessment criteria and level descriptors. Public version 19 PDF. Yeah. So what are the assessment criteria? Do any one of you know the assessment criteria? Do any one of you know the assessment criteria? Right. This is a testing session, so I'm trying to see whiteboard. Yes, organization and layout. Slides are there. Yeah, organization and layout. Come on, others. I don't know what criteria do you have? Grammar. Okay. Grammar. Yes. What else? If at all you know, just mention them. Yes, sentence formation using passive. Yes, the session has begun. It's a very, very important episode. Hello and welcome to Seven Sentinels. This is Grand Master class. And I am Peter Simon with you. Today, we are going to learn about assessment criteria and the level descriptors. Assessment criteria and the level descriptors. Yes. So normally no one bothers about these things, and we are going to focus on the very root of everything. Yeah, good evening wishes. So, yeah. So now let us see the points. Now we are bothered about the highest mark. We are bothered about the highest mark. Okay. Assessment criteria. OET writing. Stay cool, relaxed. This is okay. I'll send you. Afterwards, you can remind me. I'll send them to you. So you see, this is the public version, not official private version. There are some things behind the curtain. Okay, these are only projected to you, but there are many other things behind the curtain. Why they meant a public version? This is open to you people, but there are many other things. Private OET version, right? Now let us see here. The first one is the purpose. The first one is the purpose of the letter. Purpose. Purpose. So now what is this purpose related to? And how are we going to? And this is a very special session. So don't miss this session. Wait till the end of the session. Right. Now you have 3 bands only for purpose. Sorry, 4 bands we can say. 0 also is there. That means you will not get any mark. Will not get any mark. That is 0. Okay, now forget about 0. We don't mind 0. We don't want 0. So this is the information. Yes. So this is what the essence of purpose is. The purpose of the document is immediately apparent and sufficiently expanded as required. Then you will get 3 bands. Then you will get 3 bands. You're not bothered about 2 or 1 or 0. Just bothered about the highest. Others are low levels. Okay. So purpose of document, what document your letter, is immediately apparent and sufficiently expanded as required. So then you are going to get 3 bands for this purpose. Now, what do you mean by this purpose of document? So why you are writing this letter? Why? Okay, why? The reason. Write down the synonyms. Purpose, reason, cause, why, because of, due to, therefore, so, on account of, anything it may be. You can take anything on that. So purpose of a document is immediately means without any delay. Without any delay, the reader can understand very clearly. The reader can understand very clearly. Okay. So how is he going to understand this? Yes. This is number 1. 3 bands. Now, what should you write in the purpose? I told you every time I tell you purpose, 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 purpose. Why are you writing this letter? That means what you are expecting from the other person. You should know very clearly. So you ask, what exactly you want? What exactly you want? What exactly you want the reader to understand? Many people speak many things, but it is misunderstood because of various reasons. Okay. One clear-cut example is there is no perfect understanding between husband and wife itself. Those who live for years together, many people, we have seen number of families break up because of this very reason. They don't understand why they are doing anything. So because the purpose is not communicated properly, there is a lack of understanding, that is misunderstanding. Even if it is lack of understanding, it's okay, but it is misunderstanding. If our people who live with us for so many years, maybe 20, 30, 40, 50 years, they don't understand us, then how can the other person understand when our purpose is not very clear? So problem, if the other person is not understanding, the problem is in the speaker. If you are not clear with the message, there will definitely be misunderstanding. Definitely, undeniably, undoubtedly, or irrefutably, there will be a misunderstanding. So what purpose? Is a new person, new doctor, new nurse, new physiotherapist, new community nurse, new, then how can they understand? If they understand only, they can do accordingly. Na? What you want them to do and why you want them to do, for whom you want them to do, and when you want them to do, and why you want them to do at the most, is very important. If you cannot communicate these 5 things, what, when, where, why, and how, and the big question is why, that's the purpose. If you cannot pass on the information properly, then the other person will misunderstand and he cannot execute the work properly, because the problem is with you. You did not communicate properly. You cannot send the message through. The message did not go through. It did not reach the destination. It is cut in between because it is blindfolded, misguided, misrepresented, under explained. It's not sufficiently expanded, not immediately clear. So that is what I want to do. I am writing this letter. Today also I have seen one wonderful letter. I am writing this letter to refer. Oh my God. Are you boasting about yourself that you are writing this letter, that you are the only person who can write this letter? And this is a letter that I cannot understand. Only you understand that this is a letter. If you tell that this is a letter, then only I can understand that this is. What nonsense of common sense you are doing. Why are you giving self-importance? The other person can understand that you are giving importance to yourself. You are thinking that the other person is a dumb head and he cannot understand that this is a letter. Okay. I am writing this letter. So this is a letter and I am writing this letter. So you read this letter. Why this letter? If this letter is not there, that other person cannot understand that this is a letter. Redundant. Your purpose is to make 200 words. That is very clearly understood. You are cooking cock and bull stories. The beginning itself. You are not goal oriented. You are not purpose oriented. You are not result oriented. You are not objective oriented. You are not aim oriented. You just in between, wavering in between. What is the purpose? Who is writing the letter? Is it important for him? Whether this is a letter or not, is it important for him? So in this sentence, I am writing this letter. That means your purpose is to tell that you are writing the letter, you are important, you are writing a letter and nobody else can write the letter. So you are a special person. This is what you are conveying. If you do not write, I am writing this letter, the other person cannot understand that you are writing the letter. It is written at the bottom. Abraham Lincoln, registered nurse, medical practitioner. Then why you want to tell? That means you don't know what to write. So I became the subject of the letter. That means you are important here. That is what you are passing on the message. Remember that. Be very careful. Don't spoil the show. Don't spoil the show. Many people who do not know how to, who do not produce 200 words, 180 odd words, those who cannot construct, they just something they will cook and put there, finished. Because they cannot generate quality. So they 200 words, yeah, 200 words, 180 words, yeah, 180 words. Where 180 words? These words are redundant. Now, what do you mean by redundant? You are passing on redundant information. You are passing on redundant information. Information that is unnecessary because it is understood very clearly even by a schoolboy. Recently, I have seen one somewhere. One third class boy sent a love letter to second class girl. It seems. Huh? Letter. They understand. What is this love letter? Why you wrote? I just wrote because in the movies I saw I wrote. Letter. They also know. They also know. Second class, third class children also know what is a letter. Now, what is your purpose in telling that this is a letter to the other person? Okay. I am writing this letter. Is this your purpose? Which are still the beginning itself. In the olden days, the kings and rajas and maharajas, kings and emperors used to come there. Oh, the Lord of the universe, the master of the land, daring, dashing, dynamic, super powerful, the cheetah of the land. He is coming. Come on, all of you, stand up. This is called Band Baja Bharat. That means beating your own drums, boasting. Okay, like that you are doing. And somebody comes, that means I am writing this letter. In the beginning itself, we are telling that I am that. Avoid. Many people are writing, I am writing to refer, I am writing to, I am writing this letter. I am writing. So is anybody dancing the letter? Is anybody singing a letter? Is anybody reading a letter here? Is anybody typing a letter here? You are writing, it is understood, your handwriting is very clear. Everyone understands that you are writing, not singing, not dancing, not jumping. Redundant. Is that quality? Many people cry, literally. 7 times I have written, sir. One lady, one girl was crying, tears. Please help me, sir. Okay. Please help me, sir. And when I started teaching, she was telling, sir, nobody taught us like this, sir. This is very difficult, sir. We can. What difficult? What a difficult. Working as a nurse is easy. Working as a doctor is easy. We came to this position and you're talking about writing one sentence, it is difficult. So avoid unnecessary things. What is important, that only should go through. That only should go through. In playing cards, when you play cards, people play cards. When you play cards, you need a particular card. And that card is very difficult. Okay. So what you want? You want a joker, which will fit in every place. Okay. So that is what, when you cannot write how to write, you write something else, a joker, put it there, finish. That is what you are joking yourself here. So I am writing to refer, I am writing to discharge, I am writing to transfer, I am writing to update. So it is a common, that means you are a common figure, you are an average quality, you are a medium level, you are a very simple person. How can you pass? That's what it is. Right. So purpose of the document. What is the purpose? What is the purpose? You are introducing the patient. The purpose is to introduce something. You are introducing the patient. Okay. The next one, you are introducing his condition. You are introducing what state he is in. You are introducing what you are expecting, what he needs and what you are expecting from him. What he needs and what you are expecting from him. Okay. So these 5 things. Who is the patient? Who is the patient? What is his condition? What is his condition, present status? And why this condition is like this? What is his condition? And why this is it? What is his condition? Condition is you're referring or discharging or transferring. That is the condition. And why it is like this? Because he has recovered, so you are discharging. He did not recover fully, so you are transferring. It's very difficult for us to manage, so you are referring. You don't understand the point there. You don't understand. We cannot do anything, so we are referring to you. because you can do something. You are the boss. I cannot do anything. I'm an ordinary doctor, so I'm sending you to you because you are a cardiologist. I'm a doctor. I cannot do physiotherapy, so I'm sending to you a physiotherapist because I cannot do. I cannot do, so I'm sending you. So referring. I cannot do, so I'm sending it to you. So referring. I did everything, but he still did not fully recover. So I'm transferring. So you take care of him until he recovers. Everything is cleared. He totally recovered, almost recovered. Now he can relax. So discharge. So it is rerouting, trident. Referral, transfer, discharge. Serious problem, refer. Serious problem, refer. Problem is serious. Problem I cannot do. It is beyond my, it's beyond my level. So I'm referring. I cannot do, you do it. Boss, you're the boss. Let me transfer the responsibility to you because you are the boss for this situation. I cannot do, you do it. You handle very perfect. So that is a referral. I did everything possible. Now I did whatever I want. Now taking care of him is not my responsibility. Anybody can take. So tell him down. Send him down to the next level. Care home or rehabilitation. So that is transfer. Transfer. Until final discharge. Everything is clear, no need any care, he can manage himself. So discharge home. That's it. So next. So there comes the question of transfer letter or discharge letter or referral letter. That's it. And the situation is urgent letter. If it is not urgent, it's ordinary letter. If the situation is urgent, it is urgent letter. If it is ordinary, that's ordinary letter. So then next, what is his condition now? Condition. He was admitted. Before admission, signs and symptoms. He has signs and symptoms. He has signs and symptoms. Signs and symptom stage. Preliminary diagnosis stage. Signs and symptoms. Because of signs and symptoms, you are preliminary diagnosis. Then preliminary diagnosed with some problem. So admitted or he visited. So write down these points, somebody. Write down all these things. They are just coming from my mind. Write down and after send me so that everyone will get benefit. So first one is signs and symptoms stage. Number one, signs and symptom stage. Next, second one. Once you got signs and symptoms, you are visiting the doctor. So visiting stage. He visited the clinic. He presented to the clinic. Presenting stage or visiting stage. Is anybody writing, please? Write in a notebook also. Who is this fellow? You are also mad. Okay, so the point is signs and symptoms. You have some signs and symptoms. You're coughing too much. You have loose motions. You have stomach pain. You have migraine. You have headache. You have irritable bowels. You have chest pain. You have back pain. Or whatever. You have too much vomiting sensation. There are a lot of problems. Sneezing problem. Runny nose. Any problem. So this is signs and symptoms. These are signs and symptoms. You have runny nose. That shows it's cold. Okay. You have temperature, that shows you have fever. Signs and symptom stage. Oh, body is very hot. It doesn't mean that you have fever also. Maybe you have come from outside. You played in the hot sun. You feel hot. So, now next one. So, signs and symptom stage. Write down number 1, signs and symptom. Number 2, then you visit the doctor. You present to the doctor. So, visiting stage. So all these things will go into the purpose actually. That's why I'm telling you. So the stages here. Okay. The stages of progress of the condition. Number 1. Blessing Erseba, why is your mic on? Nobody opens the video, nobody opens the mic. Number 1. Yes. The signs and symptoms. Signs and symptoms stage. Okay. The signs and symptoms. Next one. The visiting stage or the visiting or presenting stage. The visiting or the presenting stage. Number 3. Number 3. The preliminary diagnosis stage. The preliminary diagnosis stage. So when you go to the doctor for a visit or present yourself at the clinic, the doctor will give preliminary diagnosis. Preliminary diagnosis. Okay. The next one. After diagnosing, the testing stage. So you send for tests, regular several tests. Okay. Then next afterwards, the diagnosis stage. The definitive diagnosis we can say. The definitive diagnosis stage. After the definitive diagnosis stage, it is the admission stage. Admission stage. After the admission stage, it is maybe surgery or treatment stage. The treatment or the surgery stage. The next one is the recuperation or the recovery stage. The recuperation or management stage. Recruitment or the management stage. The next one. The discharge. Sorry. The referral or the discharge, the transfer or the discharge. Okay. So these are the 9 stages. You can say Navaratnas are 9 stages in the journey from home to back home, from the home to back home. Okay. The signs and symptoms. So you have some signs and symptoms, so you go to the doctor. When you go to the doctor will temporarily, okay, diagnose you based on your signs and symptoms. Then afterwards, he sends some there for tests, laboratory testing or something, X-ray testing or ECG or whatever. So testing stage, then definitive diagnosis, confirmation stage. Okay, first one is the preliminary diagnosis. You can also say suspecting stage. This is called suspecting. To doubt something or you expect something, anticipating. Okay, anticipating. All these words you can use in your writing. Anticipating or doubting or guessing. Whatever you can say, just okay, this is not right. This is not 100% right. The next one, the definitive diagnosis or confirmation or clarification or clear picture. Clear picture is brought into the front. So now, why I am giving you all this explanation, because you will write the proper purpose there. Okay. So now where you are. Now next one, admission stage. Admission stage. Then treatment or surgery. He underwent treatment. He underwent surgery. Whatever you say. Then next, recuperation or management. Recovering stage. So if he is recovering, if it is fine, if some still not recovering, still some other problem is there, so you will refer to somebody else, some other department or some other higher authority. Okay. Then if everything is okay and still he needs care and concern, okay, support and management, then you will send to rehabilitation or you will send to care home or somebody else. And next one is, if not everything is perfect, no worry, then you will discharge home. So that is it. So these words will go into your purpose, introduction. These words, anyone will go into the introduction. Okay. So signs and symptoms. And then along with that, they say transfer or discharge, anyone will go. Right. So which is the most important and which is the latest one that you can, who has been recuperating after coronary artery bypass graft surgery. So now here recovering means after surgery recovering. So after, which is the most important area that you write. So all these stages will be going through, but when you are writing, what stage is he? Is it just a diagnosed and sent to somebody else? Diagnosed, after that what happened? Treatment is given, was being treated person. It requires. So you have to think what is the most crucial point there. Then you can write. So discharge, where is he discharged? Back home or discharged to rehabilitation before finally discharging home? Transfer to. So what exactly is it? You have to notice. Be very careful there. Then next one. Is that clear? Is the information clear? Just hit a yes or no? If the information is clear, just click a yes, because we are going to the next point. This is one very important criteria. Yeah, be generous enough to say at least a yes or a no. And next one. So that is number one is purpose. Number one is purpose. Okay. Number two is content. Content means what is the content? What is the subject? Content means there is no content in his brain. That's why he is writing nonsense. There is no proper grammar in his brain. So his sentences are confusing. There are no proper vocabulary. That's why he's writing ordinary words. Content is very important. Content, okay. Now let me tell you one thing. There is a saying, intent is prior to content. Intent is prior to content. What is your intention? To pass OET. So you write ordinary words. What is your intent? Intent means intention. What is your purpose? To pass OET. So to pass OET, just to pass OET. I just want to pass OET. So that means low. Your intention is very low. If you say, I want to excel OET, you'll fly high. If you say, I just want to pass OET, that means you're not very serious. Really not very serious. Anybody you ask, they'll just say only thing. Actually, it is a shame for us, teachers. Very few, rarely 1 in 100 or 1 in 1,000 will tell me, I want to. Anyhow, I am preparing, sir. I want to get excellent score, sir. But many people will say, what? Why this English and all nonsense? What is it for me? I just want to pass it. For that. So, what is your intent? Intent prior to content. If your intent is excellent, your content will be excellent. If your intent is ordinary, your content will be ordinary. If your intent is very low, if not this time, next time I will pass. Your content will be also very useless. First attempt only I should pass. Intent is very high. You will definitely pass. I should get 400 marks. You will definitely pass because you want 400. So you will definitely pass. Whether you get 400 or not, that is a different story, but you will definitely pass. Intent comes from within, not from lips. Intent is here in your brain. That is more important. What is your intent? Is your intention to pass OET or is your intent to learn English? So remember that one. Be very careful. Because English language is the gateway for your OET clearance. And without OET, you cannot go there. And without English, you cannot pass OET. And without content, you cannot prepare OET. Intent, you cannot have content. Without content, you cannot pass OET. Without OET, you cannot go abroad. So it is chain reaction. What is the first one, second one, third one, fourth one? If you don't eat what is already in your mouth, how will you eat the next morsel? How will you eat the first one? In the mouth, it is there. Right. So intent prior to content. Remember that. So now content. First you make in your mind all these things must be there. All these things must be there. It's not I will write something. I will write everything which is required. I will not write everything which is not required. Simon Sir said, I am writing to refer is not right. Don't take my words. See the meaning of the word redundant. Then you will know. What is the meaning of the word redundant? Let me take you there. There are many new students. Redundant. Redundant is a C2 vocabulary. Normally, many people don't know the meaning of what is redundant. Redundant means especially of a word or a phrase, etc. Unnecessary. Because why? Why? It is more than is needed. That is, it is unnecessary. It is more than is needed. You are writing, you can see the handwriting. Again, you are saying, I am writing. Mrs. Lincoln is a 54-year-old woman. Mrs. Lincoln, Mrs. is already there. Then why do you want to say woman? Man cannot be Mrs. No? Then why are you saying Mrs. is a woman? What do you think? Woman is redundant. You cannot say, you cannot use, okay? You cannot say Lincoln is a woman. You cannot say because Mrs. is needed there. So when you are already using Mrs. Mrs. refers to a woman. So why again Mrs. Lincoln? Mrs. Lincoln, a 57-year-old woman. Why woman? Is woman necessary here? Is it not understood? She is a woman because 57 years old. So woman is not needed. Mrs. cannot be a child. Woman only. Mrs. means woman only. Mrs. cannot be a child. Mrs. cannot be man. It's nonsense. It's understood. So why are you telling those things? If you are writing 10 words like this, that means you are wasting 10 seconds of a doctor's time, a nurse's time. 10 seconds is very precious. 10 seconds is very precious because in 10 seconds a life may go, a life can be saved. 10 seconds is very precious. So don't waste doctors, nurses and others' time by writing cock and bull stories. So redundant means, see here, he's telling here, she is a single unmarried woman. Now see here, how many redundant words are there? Unmarried is redundant because single means what? Single means unmarried. Okay. And woman is also redundant. She cannot be man. She cannot be man. So woman is unnecessary because she is there. Unmarried is redundant because single is there. She is single. She is single. Or she is unmarried. So I hope you understood what is redundant. It means too much and unnecessary. Too much, too much. See, it is becoming too much here. She is single enough. She is unmarried enough. It's going, she is a single unmarried woman. It's too much and unnecessary. So content. For this content, you have 7 bands, 7 points. 7 points you have for the beginning to the end. Not only 4 paragraphs. Every line of the address, everything will be counted. 7 bands. 7 bands. Already 4 likes came on YouTube. Good. So 7 bands. Yeah. Right. Now, what is this? Let us check. Content is appropriate to intended reader and addresses what is needed to continue care. Brackets. Key information is included, semicolon, no important detail missing, bracket close. Semicolon. Content from case notes is accurately represented. Content is appropriate to intended reader and addresses what is needed to continue care. Key information is included, semicolon, no important details missing. Content from case notes is accurately represented. Now there you are. Content is appropriate to intended reader. If you are writing to a physiotherapist, don't write the information related to diet. Not necessary. Not necessary. Okay. Physiotherapist. You don't need the information related to diet. Okay. Then next, he doesn't need information regarding medication. But 2 cases you have to write all the information. 2 cases you have to write all the information, everything, all inclusive. That is when you are writing to a doctor. All the information should be provided because doctor takes care of everything. Anything related to the patient you have to tell. Everything. Even habits like smoking and drinking also. Because the smoking and drinking is not required for physiotherapist. Question yourself. Turn the tables. Step into the shoes of the other person. Think that you are going to receive the letter. then guess what you need? You are a physiotherapist. You are a physiotherapist. What will you do with the information related with medication? You are a physiotherapist. What will you do with the information related to smoking and drinking? You are a physiotherapist. What will you do with the information related to diet? So try to understand what is relevant to a particular profession. Now, second profession is nurse. When you are writing to a nurse, you have to give all the information related to that, because she is going to take care of everything. Every responsibility is there, because doctor and nurse, this is absolute care. Others are only partial care. Physiotherapist, partial care. Dietitian, partial care. Okay. So they are all okay. Social worker, partial care. Community nurse, partial care. But the nurse and the doctor, the nurse and the doctor, absolute care. That means you cannot say that something is not required for them. You cannot say that something is not required for them. Yes. Next. Where is the patient going to? Is he going to a doctor who he already knows? Going back to his physician, family doctor? Or is he going to a new person? If he is going to a new person, you need not tell them the history, because he is going to the old person, same doctor. You need not tell the history. But if the person is going to a new person, he has to know about the history. For example, one doctor is sending him to another doctor. It's a referral letter. It's a referral letter. That means the person who is taking this patient doesn't know anything. He has zero knowledge. Unknown patient. We tell unknown patient, unknown patient, unknown patient. Unknown patient for whom? For you or for the other person? Okay, known case or unknown case, for whom? Many people say, this patient is unknown case. First time I am seeing him. Okay, that is related to speaking. But writing what gives? If he is an unknown patient, you will not write a letter only. He is a known patient to you already. Otherwise, how can you write about him? If the patient is unknown case for you, why will you write? How can you write a letter? Tell me. You cannot write a letter when you do not know the patient. Agreed? Agreed. You cannot, you don't have any words. I know that. That's why I only told agreed. If you do not know, Mr. Simon is a patient and he is your patient and you don't know me, then how will you write the letter? What will you write the letter? Send empty paper? Because unknown patient. Na? There is no question of unknown case here. Many people say, this patient is unknown patient. It's nonsense. It's utterly nonsense. He is not unknown patient to you. If he is unknown patient to you, you cannot write a letter to him about him. You don't know the patient, how can you write a letter about him? You don't know somebody, how can you talk about him? It's meaningless. But there is the other way around. The patient is known to the receiver or unknown to the receiver. You have to know that. That you have to take care. Does the receiver know the patient or not? For you, he is known patient. No doubt regarding that. There is no question of known patient and unknown patient for you. For the person who is receiving this letter, for the person who is going to treat him in the future, does that person know this patient or not? For him, is he a known case or unknown case? For him. Don't take it for you. For the receiver, you are sending this patient to somebody else. Does that person know the patient or not know the patient? If he already knows the patient, that means you are writing to 1 minute. I want to ask you a question. Am I talking sense or nonsense? So, sense or nonsense? Just tell me, openly tell me. I myself don't know what I am talking. It's just coming and I'm speaking out of my experience. Just hit the button first. Sense or nonsense? If you tell it making sense, then we'll continue. If it is not making sense, we'll stop. Please feel free. If you can directly tell it is nonsense also. If you know everything, sir, you are wasting your time also, you can say no problem. You are free. Marzika Malik, you are the master of your own will. Yeah. Many people don't have time to listen to this. Oh, it's okay. They will struggle their hardships. We don't mind. Okay. So only 4 people have given response. That means others don't think that it is sense. Okay, fine, understood. Very good. Thank you all. So one Neha Naveen, Bless Jose, Ushas Binu Kismat. Thank you very much for responding to my question. Because others don't want to respond. Thank you for them also. That you have proved that you are not ready to respond to your teacher's call. Okay, the commander is telling you to write one word. You are not ready to write your word. Okay, that's fine. That's no problem. Right. Thank you once again for everyone. Right. Next one. So here, right. So intent is prior to content. Intent, what you want to tell him. What you want to tell him. What you want to tell him. Intent means purpose. What is your intent? Intent means purpose. Again, content and intent, they are related. The first one is intent and this is the content. What you want to tell and why you want to tell, based on that one, purpose is the content. If your purpose is to write to a physiotherapist, your content will be related to physiotherapist. If your content is related to a social worker, you will write to a social worker. If your content is related to a care home, you will write information related to care home. If you are writing to a surgeon, you are writing information to a surgeon, you are writing information, write a letter to a surgeon, will you write about his medications? Surgeon. Writing to a surgeon. Will you write about his medications? No. Will you write about his smoking and drinking? No. Will you write about his exercise? No. Will you write about his food? No. Surgeon. I'm a surgeon. I will operate your body. Okay. Because it is not normal delivery. I'll operate cesarean and I'll bring the baby out. Your bones are broken. So I'll cut your skin and I'll put rods to your leg so that to fix your fracture and again stitch it back. What do I need with your food? What do I need with your smoking and drinking? What do I need with your physical exercises? What do I need with your retirement or not? Logical reason. Logical reason. So you have to become that surgeon and you have to guess what I want. What information is useful for me if I am a surgeon? You turn the tables, turn the other way around, and somebody is writing a letter, you think, and you are with the surgeon, you are receiving a letter, you think, what you are expecting about the patient. You should step into the shoes of a surgeon. You should turn the tables upside down. Then you will guess. Then you will get the information, what content. So you should understand. Why? Because it's a surgeon. Why? Because he does only surgery. Why? Because he doesn't need anything, he doesn't deal with anything related to diet. Why? Because he doesn't bother about smoking or drinking. Whether he smokes or he drinks, that is not his problem. His only is to do surgery and fix it. What is the information useful for him? So like that you have to. So your intent means purpose. This is intent. This is content. Intent is prior to content. So your purpose, based on your purpose, your content comes. I think you understand the relationship between purpose and content. If your purpose is to write to a doctor, doctor needs everything. His medication, his food, his exercise, his habits, everything doctor needs. But surgeon, why? Why does he need information regarding all these things? Surgeon. So where this is going? Okay. You are going to a class. So you will wear a school uniform. You are going to play football. So you will wear sports dress. You are going to a party. So you will wear traditional dress. You are going to a friend's party. You will go, style, trendy. Okay. So purpose. What is the purpose? Your content. Dress is content. Dress is content. Purpose is football. So you'll wear sport dress. You're going for a wedding. So you'll wear traditional dress. You're going to school. So you'll wear uniform. So where you are going, based on that, you will wear that type of dress. Okay. So all the paragraphs, that's it. This is dressing. Content means dressing. Okay. Purpose means goal, where it is going. What you want, ultimately what you want. End result. Purpose means end result. Content means means and ends. Purpose is end, content is means. If you want to go to a place 5 kilometers away, if you want to go to a place 5 kilometers away, you will take a scooter. You want to go to a place 500 meters away, you'll just walk. If you want to go 5,000 kilometers, you'll take a flight. So try to understand the difference. The purpose is to go 5,000 kilometers, you are taking a flight. You want to go 5 kilometers, you are taking your scooter. You want to go 500 meters, you are just walking. So that is the goal. Okay, that's the purpose. To reach cross 500 kilometers, you are taking a flight. Okay, this is the means. If you want to go to 5 kilometers, you are taking scooter. So that goal, 5 kilometers, a scooter is enough. This is a means. Appropriate, sufficiently, accurately represented. Okay. So next, you want to go 500 meters, you're just walking. So where you want to go, how far it is, why it is, all these things, based on that one only your skeleton will be, dressing will be. Fine. And now content is appropriated to intended reader, intention. You can see intent. Content is prior to, intent is prior to content. So content according to the intent. So who is the intended reader? Intention, intent. Your intent is to reach a physiotherapist. So you'll write physiotherapy related material. That's all. Don't write all nonsense. Today Ruhiba was asking, Muhiba. Hello, Muhiba.
Yes.
Is that what you are getting? That what you asked?
Yeah, regarding the writing a letter. Yes, because yeah, in the notes sometimes they give us more information which is not we shouldn't put on the transfer them to the writing letter to the when we write we shouldn't put all the material from transfer all the material from that one to this letter. It was my question because some
I'll ask you one question.
Yeah.
I'll ask you one question. Did you anytime go to the supermarket?
Yeah, of course.
In the supermarket, the materials are limited or unlimited?
Yeah, of course, unlimited. Yeah.
Your purse is limited or unlimited?
Of course, limited.
I don't want your smile or laugh. Tell me, answer.
Yeah, surely it is.
It is limited. So, do you have a list of things, or without any list, you'll go and buy anything you want?
No, of course, with the list. Yeah.
So that means you are a wise woman, definitely. So you will have a list. These are the things which I have to buy, and directly, without any purpose, you will not go to the supermarket. So this case notes is a supermarket. You can mute back. You can mute back, Dr. Muhiba. So this case notes is a supermarket. And in the supermarket, you will not buy, you cannot buy everything. It's not you will buy everything. You cannot buy everything, and you cannot buy anything. You can only buy some things which you require. Time is limited, words are limited, everything is limited. So you should carefully select those things in that 5 minutes before. That means pre-writing. Before only you have to make a list. Before going to the supermarket only you have to make a list. Okay, what you want. Before starting a letter, you should know all these things. So that's it. So based on that one, you can plan. Very good. Right, next. So now here we are giving care, ongoing care. Care is going on, and this should be continued. This care is going to be transferred. Okay, now who is going to take care? If you are referring, the higher authority will be taking care. Okay. If you are transferring, the parallel authority will be taking care. If you are discharging, the family members or somebody will be taking care. Care is always there. Care is always there. Wherever the patient is, their care is. It's only transferred. Instead of you, somebody else is doing. You did the surgery, you cannot take care of all the things, dressing and all these things. That care is transferred to some other nurse. Post-operative ward, from post-operative ward transferred to some other rehabilitation center, or from there to care home. or if everything is perfect, going home. Right. So that you have to be very careful. Continued care. Key information is included. Don't share this link with everyone, please. I don't want. Okay. I don't want anybody to come. Let them see on the YouTube if they want. Don't share this link with anybody, please, even by mistake. Because this is for my children. Okay. Who have paid for the course. And one more thing. Those who have finished your course, be generous enough. Your teacher is struggling hard. Okay, he does not want to ask you every time, pay the fees. If anybody finish their courses, please talk to me and pay the fees, because this is my bread and butter. I'm not a businessman, okay? I deserve my pay. I deserve my pay. I'm sweating. I'm doing a lot of things for you people. Okay? So I deserve my pay. Right? You are my children, no doubt. I'm generously giving you a lot of knowledge. So you generously try to pay what is my right. Don't refrain from giving what is my right. Okay, I'm giving you, paying you double with my love. So please don't do injustice to the teacher who is trying to do something for you. Right. Because I'm a teacher, I have my respect. I can't ask you, pay the fees, pay the fees. Pay. I'm giving you liberally. Doesn't mean that you can take it freely. There is nothing called free meals. Somebody says, oh, they are providing free meals, free meals, free meals. No, nobody is giving free meals. Somebody is paying the price of your meal and your meal and your meal. Somebody is paying there. In Amritsar, there is one temple, golden temple. Langar they call, langar. Langar means kitchen, where free meals are distributed. Many people are donating money, and that they are paying there. Somebody is donating that one. No meal, no free meals. You are getting free meals, but somebody is definitely paying for that one. So please, okay. I feel very sad of asking like this. Even before I ask, you have to take the responsibility. Right. Because many students, they don't pay the fees. Na? I have to call somebody else, and I'm giving free demo so that they will come and they will attend the classes and they will pay the fees. If everyone pays in time, okay, after the period is finished, then why should I invite somebody? That is enough, na? So now here, now what is needed to continue care? What is needed to continue care? Physiotherapy is needed, or food monitoring is required, or management is required, or dressing, silvazine dressing is required, or checking the wound margins is required, or cleaning or support is required, or assistance for performing activities of daily living is required. What exactly is required? Or follow up with for review is required. Scheduled review is there and you have to follow it up, that is required. Or reminding the patient to take the medications timely is required. Medication compliance is required. Or dietary regimen, nutritious diet should be consumed, that is required. Or regular physical activities are required. Walking with the supporting frame is required. What are required to continue the work? What are required to continue the work? Okay. What are required to continue the work? That's very important. So you have to see that that should be continued. If you refrain some yourself from providing the relevant information, that action will not be performed by the receiver. So whose mistake is this? Whose mistake is this? If you tell him regularly monitoring the blood sugar levels is required, the doctor told you to write that one, and you have to write that. If you don't write, how will he monitor the blood sugar levels? If you tell only, he will do. No, he doesn't know anything about the patient. No? He doesn't know what he has to do. What you tell, that only. So who is the authority? You know everything about the patient. So you have to pass on the information. How can he imagine and do it on his own? How can he manage? He doesn't know anything. What his condition is, he doesn't know. You have to tell everything. What should be done and why should be done? And when should be done and how should be done? All these things are different. They are called purpose. What should be done, where and when and how. And the ultimate purpose is why. Why should be done, what, where, when, and how. These are the 5 things, but ultimately it is purpose. How long? For 2 weeks. When? After 2 weeks, there's a review meeting. When? Okay. So all these things will go into purpose. The main question is why. Why means purpose. Why should we do it? When should we do it? How should we do it? Where should we do it? Okay. So because of that purpose, content. Because of the purpose, content. If you start reading, thinking like this, then only you'll get the information. Right. The next one. What is needed? What is required? What is expected? What is anticipated? That means what you want him to do. He doesn't want to do anything. If you don't tell him anything, he will not do anything. See, like how I am telling. Nobody wants to do one reading, one listening, one writing, one speaking. Morning onwards, I will tell anybody raise your hands, anybody raise your hands, anybody raise your hands. They don't know what they have to do. Every time I have to tell. If I don't tell them, that also they will not do. Even one thing also they will not do. Now, if I tell, don't tell you, if I do not tell, there's a class at 8 o'clock, you'll not be ready. If I don't inform, how can you come to the class? So I have to inform you that there's a class, then only you can come to the class. Without my information, you cannot come to the class. Na? So, if you pass on the information, what you want, what I want you to come to the class. So if I tell you only, you can come. Na? So what you expect the other person, the care provider or the doctor or the nurse or the physiotherapist or the dietitian or whomsoever it concerns, you want them to do something for you, and therefore you have to give a clear picture. Okay, then they will do. That's what it is. What is needed to continue care? For whom? For you only. You are telling them to do. Key information is relevant information is included, and redundant information is excluded. Irrelevant. Doesn't make sense. You are sending a patient to the eye specialist and you will write him, he has a back pain. It's senseless, meaningless. Why you are telling about back pain to a doctor who takes care of eyes, ophthalmologist? Is that relevant? Is the back anywhere related to the eye? Back you tell to a doctor. Na? Why are you telling it to the eye specialist? Now this fellow smokes and drinks. Is that useful for the eye specialist? Is it important? Is it necessary? How come it is necessary? Right. So you have to think like that. Exercise. You have to walk regularly. Is this related to eye specialist? So that is how you have to reason. Every bit of information, is it related or not? Eye specialist, what is related? That only you have to write. So, key information is included, number one. What do you mean by key information is included? Both are in brackets. Key information is included means relevant information must be there. That means it should not miss. No important details missing. That means key information should not be excluded. Only key information should be included. That means unnecessary information should not. Read between the lines. Key information is included. That means not key information. Information which is not very important should be excluded. That's the meaning. No? No important details missing. That means unimportant details can be missing. Read between the lines. There only everything is there. But nobody will read these things. One point I'm explaining. If you read this, you can understand yourself. I'm just explaining it because you cannot understand so easily. I'm explaining you in terms of reality with an example. No important details missing means unimportant details should be missed. They should not be passed on into the letter. Content from case notes is accurately represented. Accuracy. Accuracy means correctly represented. Some people write Mrs. Rosalind hints regarding Mrs. Rosalind hints. If you go to the third paragraph, he is a teacher. Now what I will be pulling my hair, this is Mrs. and this is he. I will be pulling my hair this side and this side. First of all, is this Mrs. or he? Mrs. means she should be there. He means Mr. should be there. Now what is this? Which of them is right? Which of them is right? In this sentence, you are inaccurately representing because Mrs. Rosalind Hinds is not a he but she. So this misrepresentation is giving confusion. That misrepresentation is giving confusion, is making confusion. That is what we'll go into the next part. This confusion, avoiding confusion, that is what I'll take you there. So first one is important details take. Content, there is important information and unimportant information. Important information and unimportant. Vast supermarket is there. From that limited one box of one carry bag of material you need. So you have to concise it to your one. The supermarket is unlimited. You have to limit it to one trolley or one carry bag. You have to limit it to your purse. You have to limit it to your financial resources. You have to limit it to your household requirements. You have to limit it to your salary savings. You have to limit it. This is limited. So what you have to do, 180 to 200 words, you have to limit that one. So what you have to do, unnecessary things you have to eliminate, exclude, deduct. So deductive method and inductive method. Deduct the unnecessary things and induct the necessary things. Take in induction program, take in the necessary things and remove the unnecessary things. So information is too much. So what you have to do, see for example, lemon, orange, lemon, orange. Now orange and lemon, if you see, when you squeeze it, juice will come out. And the other things, you just throw it off. You squeeze the juice and other things you throw it off. So unnecessary things, the pulp, the skin, not the total upper skin, the skin around the slices, orange slices, not complete orange. Orange skin, I am not talking about orange skin. The skin of the slices, the covering on the slices. So that is a waste. And the pulp, when you make it remove, everything will be there. So you're taking the juice out of it. So you're squeezing out the. So now these vast things, you're concising, you're limiting, you're controlling, you're restricting, you're prohibiting unnecessary things, and you're taking what is the most wanted information. Briefing, concising, briefing, limiting, picking and choosing, selection of the most relevant information. So that is called conciseness. Concise. I'm talking because I'm a teacher trainer. I'm connecting one thing to the other things. Otherwise, everyone thinks that this is different, that is different. This. See here, 5 fingers. You think they are different? No. They're not different. They have a place. They're not separate. They are together. They're always together with the joints, with connections. This will not be next to this. This will be this side and this will be this side. That's what the rule is the game. Okay. They're all connected. They're all connected. 5 fingers. You think they're separate? There is no separate identity for these fingers. This finger is connected to this finger through this joint. Okay. And all these fingers are connected through this joint. So connection is always there. Only you have to notice that. So intent means purpose. Content means message. And then from that, limiting the content is conciseness. And accuracy is clarity. What I want to tell, Mrs. Rosalind Hinds, he is a teacher. Now, where is the connection? The clarity is lost. You're sending the current. You're sending the content. Very fine. Content is very fine. Mrs. Rosalind Hinds, subject. He is a teacher. Now, where does this, the clarity is missing because it is not, it is inaccurately represented. Inaccurate. How can Mrs. Rosalind Hinds be he? Try to understand. So that is called clarity. Okay. So we are moving to the next point, that is conciseness and clarity. I have shown you here how you have to pick up from the content, conciseness and clarity. So, is that clear enough? Just give a message, yes or no, please. Only 12 students are there. See, people give fees, but you don't want to attend. What to do? Is that clear enough? Dr. Noor. Are you on duty? Say on duty. See how they are going one after another. Okay. Next. The third point is conciseness. If you do all these things, then you'll get 7 bands. You're not getting 7 bands means conciseness is missing and clarity is missing. Okay. You don't know the difference between Mrs. and he. Clarity is lost. Some people say, what is this? He has been diagnosed. How can he has been diagnosed? That happened 2 weeks before. So now also he is suffering from the problem. Suffering is okay. He has been suffering, that is okay. But he has been diagnosed. That means how long is this diagnosis going on? Diagnosis is not a prolonged, it is instantaneous. The prolonged condition and the instantaneous condition, you don't understand the difference. Prolonged condition, we can say it's going on. He has been suffering. He has been recovering. We have been managing. This is okay because these are prolonged. Management is prolonged. Suffering is prolonged. What is that other one? Recovering is prolonged. But diagnosis, is it prolonged? You will do it for 3 days or 4 days or 5 days or 10 days or 1 day. In 1 second, it is done. Send for testing. Then afterwards, study that one. And then that final decision is called diagnosis. Final decision will be taken only in 1 second. First they do study. Ultimately, they diagnose. End result is diagnosis. It finishes in 1 second. Okay, fine. You can also say he has been diagnosed. You can say, but when? If it is today. Today, he has been diagnosed. Today, he has been diagnosed. Now, he has been diagnosed. I have diagnosed, have been diagnosed. Present perfect, that's fine. Okay, if it is 2 weeks back, how can you say he has been diagnosed? People don't know. There are people who are not qualified teachers. They will be teaching whatever. Don't just believe them. That's why people are suffering. They don't have even degree of English. Okay. It is like giving me a needle and asking me to give an injection to your child. Am I a professional nurse? Do I have a certificate? Do I have experience? Instead of giving injection into your veins, I'll give injection to the bones. And the needle will break inside. Then what will you do? That is what is happening. Instead of teacher becoming a nurse, nurse is becoming a teacher. Then what? The roles are reversed. And instead of passing, many people are failing. Instead of jumping with joy, they are crying with sorrow. Nobody is bothered. Why? Whose mistake? The students' mistakes. Not their mistake. Not their mistake. They want to make money. They want to make something. They are minting money out of your foolishness. You don't know? I'm not telling you, sorry, I'm not telling you to come to me. Please don't come to me. I'm least bothered. Don't come to me, but go to a teacher who can teach English. Yeah? Even a 6th class student will not go to a maths teacher for learning English. A 6th class teacher will not go to an English teacher to learn maths. Teacher only cannot teach English. Then how can nurses and doctors teach English? I'm asking you a very big question. You have a lot of common sense. You can judge what I'm telling. If I am wrong, I'm on the internet. Challenge me. Till now, for the last for so many years, nobody questioned me. Why are you telling like this? I'm telling the fact. Just because they are explaining in some other language, Punjabi, Arabic, Hindi, or Malayalam, they are explaining something. They are very happy because they are simplifying. They are making you small children and putting choo 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 in your mouth. Yeah? They are making you small children. Instead of making you strong by giving strong food, they are making you weak and they're translating everything into your local language, and they're making you children. They're not allowing you to grow at all. They're not allowing you to learn at all. No, tell me. It is like you want to drive a car and you are given a toy car or a computer game and you say, come on, turn this side, turn this side. You're sitting in a chair in the house and you are driving a car. Where? Not on the road, in the computer. When you go on the road, life is at stake. When you go to the real exam, then you will know what difficulty and what pain you are facing. Yesterday, one student called from UK. He's telling, sir, 3 times I failed, sir. Nobody is explaining, sir. Feel the pain. What is that? Why they are not explaining? First of all, they are not teachers. First of all, they are not teachers. They are pretending to be teachers. Be careful. Okay? Go to the person, go to the teacher and tell them, explain me this question, then they cannot explain. No, 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 we don't explain. We don't explain. You have to learn on your own. Reading and listening, we don't explain. That's there itself, it is understood. They are playing the fool with you. Be careful. Be careful. Be careful. Okay? Then, so the third point is conciseness and clarity. See, for example, I don't know computers much. I know whatever I can, but I cannot do a lot of things. This is come out of experience. I don't have knowledge regarding computers. For example, I did not know how to open the what is this camera. I called my son and he said, Daddy, there is one button on the top. If you turn left, it will close. Okay. It will close. And if you push it right side, okay, it will, see now it is closed. Now it will open. So he told me, now it is opened, I think, yeah. Yes, now it is closed. I don't know. I don't know. So I was waiting 2 months, 1 month, 2 months. What is happening? What is it? There's some technical problem. There's some technical problem. Then I asked my son, he is into computers and all these things. He opens the computer and does everything. I don't understand what he is doing. So I asked him, Daddy, there is one button, just to push this side, this side. And I did it. Now you are able to see me. So we cannot be masters of everything. Teacher cannot do nursing. I cannot teach maths. I cannot teach my own mother tongue. Something called speciality. Okay, there are some village, in the village there will be village doctors. Okay, RMP doctors. RMP doctors are registered medical practitioners. RMP doctors, okay, they are also certified, but there will be some village doctors. Many villages, they don't come to the hospital for delivery. There will be one big, lady. She will only do all the things at home. There is. Okay, that is how it is. They just do like that. It doesn't mean that she's a doctor. Anybody teaching doesn't mean they are doctor teachers. Okay, there are many doctors. Are they doctors? There are many nurses. Okay, they are doing deliveries in the villages. There are no doctors in the villages. Suddenly emergency, the biggest lady or eldest lady or somebody who is experienced, okay, they will come and do all these things. Then that means that they are nurses. They don't have any certificate, but they are doing successfully. They're doing successfully. Does that mean they can go to a hospital and do the treatment? No. So like that. So conciseness. Conciseness and clarity. Conciseness and clarity. Conciseness and clarity. So I'm not just telling that one, I'm explaining everything in clear. What is conciseness? What is clarity? That is called relevant and irrelevant information. Content means what you write. In that what you write, content, there are two things. One is what information you are writing, relevant or irrelevant. Then what you have written is clear or not clear. Conciseness means limited, relevant. And clarity means what you have written is clear or not, making sense or not. So that's it. Yeah. Conciseness. Sorry. This already I explained from there. Already I explained from there. Now the length of the document is appropriate to case. Length means from the beginning to the end, it should be relevant to case. Okay. That is related to this. That is also related to this. So there he said relevant and he said no relevant, irrelevant information. There he told key information is included. That means relevant. No important distance. Here he talked about relevant. Here irrelevant information is okay excluded. Irrelevant information excluded. So remove the information which is irrelevant, not related to a particular. Okay. So remove that. Length of the document from the beginning to the end. Length means from the beginning to the end is appropriate to the case. And reader, the person, not only case, but also to reader who is going to read the letter. And no irrelevant information included. If irrelevant information is included, it becomes, like a tummy. Okay, you have to carry it everywhere. Okay, bulging stomach, you have to carry it. That is lack of conciseness. It becomes garbage. Unnecessary information. If you stuff everything, overstuffed. That's it. Then that is number one, conciseness. Conciseness means limiting to the most. That means remove the juice out of it. Essence, quintessential quality. You remove that. Next one, information. Information is summarized effectively and presented clearly. Okay. So clarity is of many things, even handwriting. If you write a B as LO or LO, LO, if you join, it becomes B. LO, it becomes B. And a B, if you write separately, it becomes LO. So you have to be very careful. So clarity, the message is passed on to the others. Okay, handwriting is also there, right? Full stop, commas also are involved there, clarity. If you don't write however, meaning is different. If there is no semicolon, there is no dash, two words, one word, two words. For example, blackboard and blackboard. When I was walking along the road, I saw a blackboard. 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 The teacher wrote on the blackboard. Is blackboard. That is blackboard. This is blackboard. Now, what is the difference? Blackboard is one word. Blackboard is one word. But blackboard, two words. What's the difference between blackboard and blackboard? Blackboard is a particular board which is used in the classroom of the traditional schools, unlike the modern schools. Modern schools have whiteboards and written with markers. Earlier, traditional schools were, they used to have blackboards and they used to write with chalk pieces, white chalk pieces. So blackboard and blackboard. Blackboard, blackboard. A blackboard is any board which is black. This is not meant for writing. Board which is blackboard. Blackboard, a blackboard which is used in the classroom is the blackboard. That's the difference. So clarity will be missing if you say wrongly. If you say blackboard as blackboard, a blackboard as blackboard, it will be a mistake, right? Over the counter. Over the counter is different from over the counter. Over the counter means freely available in the market. Meaning is different. Over the counter means what? Over the counter. It's over the counter. It's somewhere over the counter. From this corner to that corner on the counter, somewhere it is there. Over the counter means what? It is somewhere. Okay, from this corner to that corner, somewhere it is. It's idiom. It's idiom. So actually, this is not the style. This is the style. Yeah. Can you hear now? Yes. Over the counter. Over the counter. Like this or like this. Over the counter is one word, compound word. Okay. Over the counter. Drugs that are bought over the counter are bought in a shop without first visiting a doctor. Just like that way. Okay. Over the counter, like this. Drugs that are bought over the counter medicines means freely available in the market. You don't need to have a doctor's prescription for that. Just generally available, commonly available without any prescription. If you have headache, no need prescription. Just go to the market and say, I have headache and give. Over the counter. Doctor gives, that is not over the counter. Remember that. Over the counter. If a drug, a gun, etc. is available over the counter, you can buy it in a shop without having a visit. A doctor or person in authority first. Anything, drug or gun, anything over the counter doesn't mean only this one. Over the counter means freely available in the market. Okay. Freely available. An over the counter drug is bought from a shop without the person who buys it having visited a doctor first. So that means, yeah, without official prescription, but means just like that, freely available. There's a meaning actually. Available. See here, available, freely available without any prescription. Not necessary. Right. Okay. Right. So clarity means presented clearly. What you are presenting. Sometimes you write he, sometimes you write she. Clarity. Now next thing is he was given medication. He was given medication. Now we are telling he was given medication. Who is important in this sentence, he or medication? He or medication? Who is important in this particular sentence? Medication is newly introduced. He is already introduced. He is there from the beginning to the end of the letter. Throughout, he is there. Okay. The length of the document, he is there. The patient is already there. Then why are you bringing he again in this sentence? In this sentence, who is the hero? He or medication? Medication. Medication was provided. Finished, na? He was given medication. Medication was provided. Finished. So simple as that. He was given medication. Medication was provided. Now see, instead of 4 words, I am using 3 words. Unnecessarily, I am bringing he. So which is important? Medication. Medication, I am not giving importance. So here, medication, I am giving importance. It is the hero of the sentence, I am giving that one. So clarity is very important. Now I am talking about medication is provided. So what is important I am talking? Why should I talk about he? He is not important in this sentence. Why am I bringing he here? Why am I complicating the thing? Every time I should bring he. That means without he, I cannot tell. That means I don't have English knowledge. I cannot create a sentence without he. I cannot give importance to the important thing in the sentence. You are accepting the fact there. You're not able to clearly manifest the importance in the main subject. Instead of manifesting importance to medication, you are manifesting importance to he. Instead of making medications important, you are making he important. So what is happening here? The importance is dead there. You are making curd into buttermilk, and you are pouring more water, and making the taste out of it. Medication is provided. What is the problem? What is he doing here? Huh? I told you many times, the Prime Minister of India cannot go to every state and cannot become the Chief Minister of every state. It is degrading the standard of the Prime Minister. Okay, that is bigger terms. Let us talk smaller terms. The headmaster of a school cannot go to every class and teach every subject. That's the point. He cannot do. If he goes to one particular class and teaches in that one, then who will do the headmaster responsibility? That means you are demoting the level from headmaster to teacher. Now, if anybody comes there and listen to the class, will say, this teacher is teaching very nicely, will say. They will not say his headmaster is teaching very nicely. They will not say. Because they are first time seeing him teaching. He will not say headmaster is, no, his level is degraded. His standard is deteriorated. Mrs. Rosalind Hinds, aged 38. Already we made it an emperor of the letter. Mrs. Rosalind Hinds is from the beginning to the ending. It is the title of the letter. It is the title of the letter regarding this complete letter. Paragraph 1, paragraph 2, paragraph 3, paragraph 4, paragraph 5. Everything is regarding Mrs. Rosalind. Why again he and she is coming to every paragraph? Are you not spoiling the show? Are you not degrading the level of Mrs. Rosalind Hind, making the subject of the letter itself, making the subject of each and every sentence and making a khichdi out of it? Nonsense out of it. What is every sentence has something. You are introducing a new sentence, means there is something new in it. Make that one the subject of the sentence, na? Instead of giving that one conciseness, you are expanding that. 3 words become 4 words, 4 words become 5 words, 5 words become 6 words, just because of this he or she. He was prescribed medications. He was prescribed medications. Medications were prescribed. See here, 4 words, here 3 words. That means, is it concise or is it expanded to another extra word? You are expanding, in fact. You are not concising. And unnecessarily, you are degrading the quality of the sentence by bringing he and putting unnecessary intruder. The power is lost, weakened, the strength is lost, weak bond. So, what I am telling you is, which is the newly introduced subject in that particular sentence, you take that one and start the sentence with that one. That is called the subject of the sentence. The subject of the sentence. Give me a minute, please. I can finish off this lecture in 10 minutes. But what will you understand? Again, same thing. Back to the pavilion, nothing understood. So I'm trying to give the importance of all these things. At least you'll change your attitude from next time onwards. Okay. And then so information is summarized. Summary means gist, concise. Information is summarized, means made short, made simple, gist form, summary form, concise, brief, not expanded. But every sentence you are expanding. Where is summarizing? Where is limiting? Where is briefing? Where is making it a gist? Huh? First one, that is conciseness. Summarize effectively means condense as small as possible. Okay. Don't expand. Don't expand. 6 minutes already on the YouTube. Yeah. Right. Okay. So presented clearly. Presented clearly. Clearly means what? No confusion. Yesterday, he has been diagnosed. Yesterday, he has been. On last week, he has been admitted. Last week, he has been. What do you mean by this? It is chaos, not confusion. Clarity, forget. Clarity, forget. Confusion, forget. It is utter chaos. I don't understand what nonsense he is talking. Last week, he has been diagnosed. What do you mean by last week he has been diagnosed? Has been is present perfect tense. It is one of the groups of present tense. And you are saying last week. That means time division is week. This week is present tense, last week is past tense, next week is future tense. Now last week, how can it be present perfect? Today, I have been teaching. Today, I have been teaching. I have been teaching for the last 6 hours. I have been sitting in this chair for the last 12 hours. So, yesterday, I was sitting in this chair. Yesterday, I had sat for almost 6 hours. I had sit for 6 hours. V3. I sat for 6 hours. Yesterday, I had taught for 3 hours. Yesterday, today I have taught for 6 hours. Yesterday, I had taught for 6 hours. Present perfect means finished. I have taught means finished. No more in the future. I have taught, accomplished, mission accomplished. Yesterday I had taught. Then how can you say yesterday I have taught? Past perfect you have to use, no? Why are you using yesterday, present perfect? Last week. Long. So be careful. Clarity is missing. Confusion. Because you don't know what tense you are talking. And you are telling yesterday and you are telling I have Yesterday, the doctor have prescribed. The doctor has prescribed. And there are many people who say like this, the doctor have prescribed. The doctor have prescribed. The doctor has prescribed or the doctor have prescribed. Many students, I tell them, oh my God, tens and tens of times I tell, but the blood, got spoiled. That blood should be removed. Dialysis should be done 3 times a week. Then only that blood will become clean. You should take this brain to the Dhobi Ghat and wash it clean. How many times I tell the same thing? It is not going inside, it is coming from here and going from here, or it is going above the heads. The doctor has prescribed or have prescribed. Even after telling, they don't change. Why they are not changing? Because there is no intention to change. First of all, you should realize that somebody is telling something important. And that important, you should take it very seriously. And after taking seriously, you should learn the system. And when you learn, you have to practice. And when you practice, you have to check and confirm. So these many, yeah, this many, they will say. No, not this many, these many. Many means plural. This kind of, these kinds of. These mistakes which I am telling you, many students are doing, not one particular student. Many students. Okay. These kinds of, or this kind of. No, clarity is missing. These kind of problems, these kinds of problem, or this kind of problem, this kind or these kinds, this kind or these kinds. Singular, this kind, only one kind. So this means singular, these means plural, these kinds. So this will go with kind, these will go with kinds. So why are we not passing on the information clearly? Now I understand, is it this kind or these kinds or these kind or these kinds? Now what is right here? Instead of telling correctly, you are telling wrongly and you are confusing me. He is talking about singular or plural. There is no clarity. Kinds means plural, this means singular. Where is the clarity? Tomorrow I am going. Tomorrow I am going. What is this? Tomorrow I am going. What is this? Tomorrow I am going. Tomorrow I will go. So future tense. Tomorrow means a day. Today, tomorrow. So day. Yesterday, today, tomorrow. So it is divided on day. So day is the thing. So tomorrow is the next day, not this day. Today I am going. Now I am going. Tomorrow I will go. So tomorrow is future tense. The word tomorrow is there, automatically it should become future tense. What is the date, a time related word you see? Week. So this week present, last week past, next week future. What is the time related word? Day. Today, present tense, yesterday, past tense, tomorrow. Month. March, present tense, February, past tense, April, future tense. That's it. Year. 2023 present tense, 2022 past tense, 2024 future tense. So what is the unit of time based on that one? So clarity is this one. So that is clarity. So confusion should not be there, either in handwriting or in understanding. That is very clear. Yeah. So next one, for many people, they will not be there here because they don't understand these things also. First of all, they don't want to understand. They don't want to learn these things. So they will not be. They will not be. They don't want. What is this? Conciseness and clarity. Next, fourth. Genre. Style. Genre and style. So what is this genre? What's this genre and what's this style? Style is formal style. Style is official style. Formal style means what? Formal, short, simple, perfect. That is formal style. Okay, acceptable, flawless. That is style. Genre. Okay. So genre is related to different things again. You are representing facts, or you are representing doubts, or you are representing imaginations, or possibility, or accuracy. Okay. What are you passing on the information? Yeah. Genre and style. Writing is clinical, factual. Writing is clinical, factual. Uh, Writing is clinical, factual. Factual means real, okay, and appropriate to genre and reader, discipline and knowledge. So, technical language should be used, abbreviations and polite language are used appropriately for document and recipient. So, you can use some abbreviations, okay, You can use some abbreviations. And polite language. What is polite language? What is polite language? If you say, please note, he has a review on the 26th of May. Please note, he has an appointment. So, off note, please note, we'll tell all these things, right? Okay. Now let us see. That is style, politeness. Please, it's polite, definitely. But please is not polite actually. Please come here. Please come here. It's not formal. It's not formal. Please is not formal. Please is personal. Please come here, as if you are begging somebody to come, requesting somebody to come. Please. Politeness should be there, but begging and requesting should not be there. This you are an officer and he is an officer. Nurse to a doctor, doctor to a nurse. Both are officials, government officials. Both are working. Of course, doctors have a higher responsibility because there should be some leader. So doctor is the leader of the situation because he has higher knowledge. It doesn't mean that nurse is less. Okay. And nurse also, when talking to a doctor, please, 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 no need, please. No need. Talk formally. Talk in style. No need. Please, sir, come, sir. Patient is waiting, sir. No need. The patient taking medications is suggested. Education is required. Please give education regarding. Education is required regarding dietary compliance. Please explain him about. We are spoiling the show actually. We are spoiling the show. Instead of professional, we are making it personal. Professional, we are making personal. Oh, doctor, I should be very. No, make it professional. Professional is very higher level. Okay. Respect is respect there, but be professional. Okay. So how you have to talk? Right. Insulin injections are recommended. Finished. Right. Please monitor the injections regularly. Please monitor medication compliance. Why should I tell you please? Why should I tell you please? Are we friends? Are we friends? Please, where it is used? In requests. Why are you requesting a doctor or a nurse or somebody? Why are you requesting? Why should you request? Okay, I'm not telling it is wrong. I'm not telling it is wrong. It's genre and style. What is please? Where please is used mostly? Please is used to request somebody. Do you know the meaning of request first of all? What is the meaning of request? What is the meaning of request? Request is the opposite of command. Request is done to squeeze mercy from others. Squeeze mercy from others. We know that somebody is higher, or we cannot make him do, then we request them. Polite language is different. Request is different. Polite request is different. We are not bothered about request here. We are bothered about polite language. There is no question of request. Why are you writing in the last paragraph? Please, kindly. Why? Is it a personal letter? Please come to my house. I want to enjoy some time with you. Please come. This request you are doing when you feel that the other person will not listen, and when you want to compel him, you fall down, you lower yourself, standard down, and you think that the other person is higher, he must go. Please, 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 your head will fall down. Please, means what? Your level, you are degrading your level there. Number one. Number two, you tell please when you accept that you cannot help it. He is the only last option. So if you say please, he will do it, and you want the things to be done, completed, so you will request him. What is the need for you to request him? Why should you request him in the first place? Are you not equal in professional standards? Any profession. Nobody is less, nobody is more. This is called dignity of labor. A doctor, a nurse, a pharmacist, a physiotherapist, a community nurse, a social worker, who is less? These are only substitutes. A doctor is great. No. Doctor is not great. Nurse is great. No. Nurse is not great. Nurse cannot do doctor's activities. Doctors cannot do nurses' activities. So they are substituting the work they cannot do. A nurse is doing those activities which the doctor cannot do, and the doctors are doing those activities which the nurses cannot do. They have their watertight compartments. No one is less, no one is more. What will the doctor do if there is no nurse? If there is no nurse, what will the doctor do? He will say, wait for some time, the nurse will come and give you injection. The doctor cannot do all the jobs. Okay. Only the local doctors, RMP doctors and those doctors, they only do everything. They do everything because they don't have anybody else for them. They get little money, that money they don't want to give. They will do everything. They will give injection, they will prescribe, they will check, they will do everything they only do. Okay. But here, the work which I cannot do is substituted. See, for example, teacher is great or nurse is great, or teacher is great or doctor is great. Nobody is great. A doctor is doing those medical services to the society which a teacher cannot do. A teacher is giving those educational training which doctors cannot give. Substitutes. No one is great, no one is less. So there is no need to be requesting these people in professional standards. When you start requesting, that means you are degrading yourself. Remember that. You are accepting that the other person will not do it. Please give me a holiday, sir. Means you know that he will not give. So that's why the more the rejection, the more the request. If supervisor will say, please. If you go to the big boss, then please, sir. That's it. If you have small difficulty, you say please lightly. If you have large difficulty, you will say please, and you bend your head like that. So that is the nature of the word please, request. No need to request because this is formal letter. This is formal letter, not informal letter. You are not writing to a friend. Please come to our house because there is a, we cannot enjoy without your presence. Your presence will let. Okay. So there you can say please. Because you want them to come, otherwise they'll say no. So you are saying please so that they will not say no. And please is even more powerful than a command. People cannot say no. If you say, come here, they'll say, why I should come? But if you say, please come here, immediately smiling, smiling, they'll come. Please is a very powerful weapon also, but informal. Okay, informal, not informal. Official. See, for example, in the books, in the big books, law books or medical books, anywhere please is there? Formal. In your medical books, is there any please? In law books, is there any please? Nowhere. Formal, no please. Don't use that. Instead of say polite language. Polite language. What is polite language? Okay. Polite language. By removing your self-importance, not degrading the person who is in front of you, and upgrading the subject of the sentence. So what is subject? That you lift up. Don't give self-importance. Don't give grade to you. Don't degrade the others and lift the subject up. That is called formality. What is important? That one, put it up. The books should be brought every day. Please bring the books. Will the headmaster tell you, please bring the books? No, he will not say. The teacher will not say, please bring the books. Books should be brought every day. He will not even say, bring the books. Bring the books means command. Okay. So bring the books means order. Bring means command. Please bring the books request. These are not polite at all. These three are different variations. Polite language means giving the subject its due importance without hurting the others. For example, if you use request, you are self-hurting. You are self-hurting. Anytime request is self-hurting, you don't know. Request means self-hurting. Please come tomorrow. Tomorrow is my birthday. Please come. That means you are hurting yourself. That means without your presence, my birthday is meaningless. My birthday is meaningless without. Please come. So try to understand what I'm telling you. This is self-hurting. Okay? Self-hurting. And if you say, come to my house, it is order. Tomorrow is my birthday, come. This is command. You're offending the other person. Request is self-hurting. Commanding or ordering is hurting others. I'm just talking about polite language. So no please, No request, no command, no order. Talk to the subject. Point, on the point, on the point. Talk that much only. Don't bring yourself to request. Don't make commands or demands to make to degrade the other person. Take the medications regularly. Give him. This means you are ordering the other person. He'll feel hurt. He will feel hurt. So why are you taking? Why are you take the medications? You come here, you go there. Means you're ordering me like that. You degrading him. I tell you, you come. That means I am more, you are less. Please come here means I am less, you are more. Be careful. This disparity should not come in formal style. Avoid them as far as possible. Formal genre, formal style. How you can say? Medication compliance is required. Finished. I'm not telling you monitor medication compliance. I'm not telling him. I'm just telling this is needed. I'm not telling you do it. This is important. So where does self-hurt comes? Where does self-hurt come? Where does degrading the other person comes? Medication compliance is required. Finished. I'm not telling you to monitor medication compliance. I'm not telling you. But this is important. That's the meaning. By whom? By you or by somebody or by some other nurse. That is not matter. Nobody. This is important. Who is monitoring is not important. Monitoring only is important. So right to right formal style. Technical language. What do you mean by technical language? Technical language is very important in writing. Technical language is not important in speaking. Why? Now let us say urinary incontinence has been managed effectively. Now, if you tell the patient, you have urinary incontinence. What German or Latin or French are you talking, doctor? He'll be looking at you like this. That means what? You useless fellow, try to explain in my language, not your language. That's the meaning. Indirectly. That means I cannot understand what nonsense you are talking. Can you please explain me clearly so that I can understand in my level of words? In speaking, you cannot use this technical term, incontinence. Now you have to explain in normal words to him. But in writing, you are writing to another medical professional. The other medical professional also knows what is incontinence. If he doesn't know, that means there is no meaning. He doesn't have knowledge. So style, this style you are using in writing, but you are not using in speaking. Why? Because the person who is receiving your words is the patient. Here the person who is receiving your words is a doctor or a nurse. Doctor knows, nurse knows, because they are your medical jargon. They are your medical jargon. Jargon means is a linguistic term. Those who did not attend this session can watch in the YouTube. Anything missed? Okay, it's all there. Jargon. But the same influence will not be there. A real teacher is there, so that influence will be different. So jargon. Sorry. Jargon is C1 vocabulary. Jargon is C1 vocabulary. Usually it is disapproving. It's a C1 vocabulary, but it is disapproving. Disapproving means, he uses all police jargon. Doctors use medical jargon. Okay. That means we don't like, they use it, but we don't approve them talking like that. So jargon. Jargon means special words and phrases that are used by particular groups of people, especially in their work. Military jargon. Military jargon. Attention, stand it is, left turn, shoot. Okay. Run. This is military jargon. Attack. Medical jargon. Case, patient, bed, buzzer, injection, needle, syringe. These are medical jargon. Doctor's jargon. Stethoscope, surgery, operation, nurse's jargon. Injection, dressing. So, jargon. Teacher's jargon. Pen, paper, notes, lecture, grammar, vocabulary. Teacher's jargon. What I am teaching is subject. I have taken one sentence and I am explaining almost for half an hour, means how much subject it is there, how much experience is there. Can a nurse go and teach like this? Even for a high school, 6th grade, they should be, okay? English subject, then teaching B.Ed. Without subject, without teaching methods, they don't know. For example, if I say inductive and deductive method, you go and ask those nurses, inductive method and deductive method. What is that inductive method? Insightful theory. What is insightful theory? Huh? What is insightful theory? Psychological theories of learning. What is psychology? What is approaches, techniques, strategies? We all learn all these things. Like how you take injections, give injections, and do all these things, or medical surgery, like that. Teachers, English teachers, English methodology, English language plus English methodology, right? Mathematics teachers for mathematics methodology. How to teach mathematics, that is teaching. Education and teaching, we have made 2 certificates. But these people definitely they come. I don't feel sad because they are teaching. I feel sad because the students are suffering. I'm least bothered about them. Let them teach, no problem. I don't have any problem with nurses teaching or doctors teaching. I don't have any problem. I don't bother about those people who are teaching, first of all. I'm bothered about the student community who are in pain, in suffering. I don't know, sir, if I go to UK, I can give a nice life to my children. I can give them good education. These dreams are thrashed by these false preachers. That's what I'm telling you. I'm telling this openly, I'm telling. On the internet, I'm telling openly. If anybody can challenge, let them challenge. Because I know what I'm talking. I know. I'm like an elephant talking here. Once upon a time, there was one famous institute. I don't want to take the name of the institute. Famous institute. Okay. He told me, how can you tell that nurses cannot teach? He is saving your bucks. That idiot told me, he's an idiot. He told me, how can you say that? Nurses cannot teach English. So many nurses are teaching. So if I give injection, I'll also become nurse. Huh? If I want to give an injection to your child, you will beat me. And still if I do something, then you will put me in the jail. Why this then? The same thing they are doing. They are doing the same thing. Only they are not playing with your life, but they are playing with your peace. They are playing with your money. They are playing with your time. They are playing with your feelings, your emotions, your dreams, your desires. They are playing with your all these things because you are not wise enough to judge what is right and what is wrong. It's not their mistake. They're just doing business with you. And they are the best. Because you know why? You want people who please you, simplify things for you, teach in your mother tongue. Yeah, very good, very good, very good. You want less time, more. They are giving less time, taking more money. Those who want to give more things, you don't mind. You don't want. Because shortest time you want to jump over the ocean. That's the problem. Okay. So be careful. It is your game. You have to play safely. If you keep your $1,000 bill in front of everyone, saying that I don't have a pocket, I kept it there, anybody can snatch it. So that is what is your future. That is what is your time. That is what your everything. It is your responsibility to save your money, to save your time, to save. You keep your phone there. Somebody takes the phone. So who is to blame? The thief or you? It is your carelessness. You have to protect yourself. Okay. Sir, I have lost a lot of money. I have spent almost 2 lakhs, sir. They have spoiled all my money. They did not teach me properly. Whose problem? Your problem. Okay, you have to. Okay. Even the farmers, they keep scarecrows so that crows don't come and eat all the grains. Then how can you not protect yourself? That's the point. So, jargon, special words and phrases that are used by a particular groups of people, especially in. So you are talking with your professional. Medical people are talking to medical professionals. So you have to use medical jargon. Now, what is that incontinence? Incontinence. You will see the word medical there. Medical. Can you see? You have to use that. Because you are a doctor and you are talking to a nurse, you are medical field, she is medical field, so you have to use the medical jargon. Why don't you use the word incontinence? You say, he cannot control his bowels. He urinates frequently. And he wet his pant and beds also. Bed sheets. So why telling all these things? His problem is urinary incontinence. Finished. The other person can understand because he is a doctor, you are a nurse, both of you can understand. Medical. So that is what I'm telling, jargon. You have to use the words related to your profession. But when you are going to a layman, a patient, he is not your field. So how can you use medical terms there? Be careful. That is called genre and style. What is it, clinical related material or not? Clinical related, that means everything in writing is clinically related. It is not related to patient. You are not writing to patient. You are a medical professional is talking to another medical professional about a patient. It's not medical professional talking to a patient or not patient talking to the medical professional. Patient is only sidelined. One medical professional is talking to another medical professional. So they belong to one medical field, one area, one group, one denomination, one division called medical. So you can use all the medical related terms there. So, and now politeness. Politeness. Urinary incontinence. For managing urinary incontinence, comma, dash has been prescribed or something. Or for managing his asthma, dash has been prescribed, nebulizer or okay. So we can write like that. Polite language. What is polite language? Polite language should not be request. Polite language should not be. Polite means requesting is polite, you think. No. Request is not polite actually. Request is not polite. Polite requests are there. But request is between one higher authority and one inferior authority. Command is from higher authority to inferior authority. So request is upwards, request is traveling upwards, command is traveling downwards. It's opposite. Okay. Request is submission, command is superposing. Okay. So be careful, don't use both. Use polite language, not polite request. May I, would you mind? That is polite request. Request, polite request. But polite language means talking according to the need till there only. Emancipation. What do you mean by emancipation? Emancipation. Emancipation means not favoring anything. Emancipation means the process of giving people social or political freedom and rights. Okay. Emancipation means right. The act of freeing a person, liberating a person from another person's control. So, request is also control. You are under the control of boss. Command, you are controlling your junior. Control is there. That control should be removed. That means freely. Talk freely. Don't say I am important. Don't say you are important. You are important means it's a request. I am important means it's a command. Try to understand what I am telling you. Years of experience. Just not telling like that overnight. So, control is there in both request and command. Please give me leave for 2 days. That means I am under your control. Okay. Commanding. You have to attend the office without no leave. You have to attend. This is order. So you are under my control. That's the meaning. So control is there. This control should be removed. Emancipation. The act of freeing a person from another person's control. So no request, no command. I think I'm clear enough for you what I'm saying. So no request, no command. Don't say please, don't say kindly, don't say please. No please and kindly. Okay. If you are writing to big persons, we don't use all these things officially. Official things we don't use. So instead of that one, use polite language. Now what is polite language? Polite language means giving the importance to the subject of the sentence. The newly introduced topic. One sentence you are talking about medication. In another sentence you are talking about exercise. In another sentence you are talking about dressing. In another sentence you are talking about monitoring. In another sentence you are talking about alcohol consumption. In another sentence you are talking about smoking. In another sentence you are talking about something else. Make that important thing the subject. Smoking cessation is recommended. Not only smoking cessation is recommended, but also reduction of alcohol consumption is suggested. So not only but also remove. Smoking cessation is recommended. Reduction of alcohol consumption is suggested. Finished. We are not telling please monitor or monitor. Please monitor is request, monitor is command. So why should you say you, ma'am? No need. No need. Just be point blank. Point blank. Hit the target on the forehead. Bullet should be directly in. Answer, topic, same, straight. Justice done. So, polite language, technical language, abbreviations, and polite language are used appropriately for yes. So, subject is very, very important. So 4 points I have talked. From where what I talked, I only don't remember. Just I took 4 boxes, very small sentences, and so much I explained. From where did this come? Go and ask those nurses who are teaching. They explain these things. I'm not against nurses. Nurses are the angels of God who are there to save the lives of the patients. But there are some people who are making use of these nurses. Okay. They want to go to UK. In the meantime, 4 or 5 months or 6 months or 7 months for the processing. That time they are using and they are giving some money. So they cannot continue their work. So they resign in the due process. And in the meantime, just time pass. They are not going to be teachers. They don't have that passion also. They have passion to do nursing. That's why they don't leave their job, no? Right? They don't have certificate in English, first of all. So that's what I'm telling. I'm not against nurses by any way. Actually, I respect nurses who are real nurses and who do nursing. Okay. That is what it is. Right. These nurses, they can do what even the mothers and fathers and brothers and husbands cannot do. Wives cannot do, these nurses too. I have seen literally. My father, when he got his fracture, he was on the bed. He could not get up from the bed. Everything on the bed. It was the nurses who did. I have seen that literally. And my salute is always there for the nurses. But beware of false preachers. They're not meant to teach. They're not certified to teaching. Things are going on, doesn't mean that it is right. If 100 people do wrong things, doesn't mean that it is right. You see, you travel in the trains. You travel in the trains and you travel in the flights. You know the difference. You travel in the buses and trains. You travel in the flights. See the difference. In the flight, not even one thing will be on the ground. Decency is 100% maintained. But you see in the trains, nobody bothers about decency. They eat groundnut and they throw the shell on the ground. They eat samosas or pancakes and they take and throw it on the floor. They drink tea, they put the cups down. Everything on the floor only. They don't even bother. But you go to first class, second class, AC, they will not do that. They will not do that. Why I am telling you this means, let me tell you one thing. I am telling you very clearly. The people who are flying in the flight, they will never throw anything. Because even the person who throws everything in the train on the floor, he will not throw anything in the flight. Why? Why? Because there he knows that he will be punished. He will be questioned. And everything is very neat and clean in the flight. So he will not throw. He will eat everything and put it in a plastic cover and put it there in the bag in front. But he will not throw anything down. Why that much care has come? But when he travels in the train, why he throws everything on the down? So that is what I am telling you. Style and genre, they should come from within. These are pretentious. According to the situation, they pretend. Wolf in the sheepskin. They are chameleons. They mold accordingly. They mold accordingly. Okay, they change according to the situation. They do whatever anything like that. So that's the thing. So time being, anything that's not fine. They don't have the passion to make the surroundings clean. If the surroundings are dirty, they will also make dirtier. If the surroundings clean, therefore they'll be very careful. That's it. But a person who is very civilized and disciplined, he always follows the discipline. Discipline right from getting up till sleeping, going time to duty, timely coming from duty. Nobody will point out at it. This is called discipline. That is called style, natural style. Okay. So that's it. And next, 4 points are discussed. 4 points discussed. Now let me see. Yeah, now it is 23:46. Now 4 points discussed. Then how many more are there? So 2 more are there. Today I did not order dinner also. Okay. So right, 4 over. 2 more points are there. Organization and layout and language. Organization and layout and language. I think I need a break. Yes. So, break. What shall we do? Shall we continue tomorrow? I think it's enough today. It's too much. It's too much. A lot of things we have discussed. There are only 4 points: purpose, content, conciseness, and clarity, genre and style. 4 points. But we talked so much. Okay. We talked so much. So we can take it into the second lecture. We'll take into the second lecture. So, right. Yeah, please. At least, how many people are there? 8 are there. 7. 7 means I need 4 people. 4 people say yes. Mohiba, Binsi, then Shabnam. One more I need. Majority, no? One more. Binsi, Mohiba, Shabnam. One more. Pranita, 4. Yeah. So we'll call it a day. I'm tired. No? By my bad luck is I did not order anything and I did not cook anything today. That's the thing. So something I have to do. Oats. 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 Okay. Goats eat oats. Goats eat oats. Okay. So just to give your feedback regarding the session, please. How is that? Give your feedback regarding the session. Mute all, unmute. Yes. Yeah, Muhiba.
Yes.
Yeah, Muhiba, share your experience.
Yeah, it was very good. So now I understand I have to hear how to write. So yeah.
What you understood? What you understood? Simon sir eats our plates for hours together without any pause and break, right?
Yeah, so I should, and the purpose was very important. So I understand now. So it should be for the, of course, if it is a referral, if it is discharge letter, or if it is, for example, a transfer letter, it should be obvious and it should be clear. And then other the criteria, it should be very clear as well. So we should use the very formal language, and we can use any all technical language because all of them are professional. For the we should so I should pay more attention on the tenses as well, because it was my problem as well, because all the time I was Aviva, I haven't written anything for you, but normally it was my habit that I wrote for example, this was diagnosed, but you said we shouldn't use it, and now I know why.
Okay. Yeah, Shabnam.
Hello.
Yeah, Shabnam.
How are you, sir?
I am fine.
Yes, sir. Today's session was very nice, and I can understand now how to write and the formal letter, whatever you teach. It was very nice, whatever you taught us, and this fantastic. So I'm doing now continuous. Tomorrow I will again continue this lecture, and will also continue the speaking session with you, inshallah.
Yeah.
Hope so
Okay.
you give me some time.
Yes. Thank you very much. Blessing.
Thank you, sir.
Yeah. Blessing.
Thank you, sir. Thank you. So nice of you.
Yeah. Thank you very much. Blessing, Yerseba. Blessing. Kismet Ani. Kismet. Yeah. Share your experience, Kismet. Kismet. Yeah. Bless Jos.
Yes, sir. Hello, good evening, sir.
Yeah. Bless Jos. Share your experience.
So the class was really useful. I mean, I always had the problem to know that what about the criteria which is not easy to always retain in mind. But especially the criteria part was really good. When you gave us so many examples by saying that how to use properly language, grammar, punctuations, and the way you have to write organization. So it was really beneficial. Yes, need to careful more when we write.
Okay. Yeah, right. Thank you very much. And then next to Vincimol Thomas. Vincimol Thomas.
Hello, sir.
Yeah, hello, Vinci. You don't have duty tomorrow morning? Why are you sitting for so long?
It was so interesting. I was attending from the beginning and I was understanding things. So it was really interesting. So I was listening to your voice and I was trying to understand what was my lacking. And today I got a lot of points from your lecture and I wanted to change my style of writing and I want to improve myself. So it was a really an eye opener today.
Okay, fine. Yes, Kismet. Kismet. Okay, then. Yes. Okay, good night, all of you. Thank you very much.